Hey, good evening, everyone. I'm just going to do a quick introduction. I'm Ali Pelletro. I'm the AOR with ITAC. It takes a community. We're a drug and alcohol prevention coalition here at Iroquois schools, and we work in the immediate area. We have Patrick Green, who's on Zoom with us tonight, is doing the presentation, and I'm going to hand it over to him to do a little bit of an introduction and get going. All right.
Thanks.
Thank you.
Thanks, Alec. Hello, everyone. It's great to be here. I am from Horizon Health Services, and I'm a licensed mental health counselor. And I've been asked to come in and do a presentation today on trauma-informed care. Um, so those that are on screen, just out of curiosity, familiar with the concept of trauma-informed care. So this isn't anything new that I would be providing, but just perhaps maybe a different angle, or perhaps there's something in this that will be helpful for you, or maybe even a reinforcement, or just a validation that in whatever you're doing, that you know if you're experiencing uh, challenges, or you find, the stress, that this is not something that is unique to you, but this is part of being human. Now, if I'm understanding correctly, most of you are doing something in the helping field or working with students. Um, so am I getting that correct? Great. So today we're going to talk about a couple of things, trauma, but also, because of the holiday season, a little bit of um, grief and loss, and how those two elements actually can kind of combine. And then a little bit of some strategies to attend to them, and some coping mechanisms as well. So I encourage questions, so feel free to ask away at any point. Um, and I believe Allie will be kind of monitoring the chat. So if there's any questions, we'll just go ahead and interrupt. And well, of course, we'll have some time at the end to take questions as well. So let me get started and share my screen. All right. So the first thing I just wanted to do is define what I mean by trauma. I use a pretty broad definition. I've taken it from Deb Dana, who does a lot of work with the polyvagal theory. Um, and she describes trauma like this: too much too soon, too much for too long, not enough for too long. Um, and if any of those things are happening, our systems will typically have a trauma response. Um, so what we're going to talk about today, we're going to talk about trauma and a little bit of what's happening in the brain and the body. We're going to get into a little bit of grief and loss and what that looks like. We're going to talk about ways of connecting, and also some coping mechanisms. Some really important concepts that I want to highlight in terms of trauma, I take from Dr. Peter Levine, who created the therapeutic modality somatic experiencing. When he talks about trauma, he talks about it in terms of this: that trauma is not what happens to us, but it's what we hold inside in the absence of an empathetic witness. And that trauma the bodies of traumatized people are snapshots of unsuccessful attempts to defend themselves in the face of threat and injury. So what does that mean? That it's stored in the body, and it manifests in all sorts of different ways. And so things that get stuck or stored in the body are, for example, the survival dilemma. where someone might be faced with a dilemma of the instinct to fight, but also the instinct to submit if that's what's necessary to survive. That both things could be happening in the body, that push and pull, and then that gets stuck inside, um, or fear in immobility. Um, that these two things are also kind of create this dilemma. The fear is more of activating kind of force, and immobility is shutting down, and both could be happening simultaneously. Um, or incomplete survival responses. And they could be coming from the survival dilemma or fear and immobility, that the instinct to do something to protect oneself gets stuck, and then that kind of gets repeated over and over and over again inside. And what we see is the manifestation of that. Um, So I use the iceberg as an analogy to describe the things that are happening that we're aware of and that what we're not aware of. And so the explicit, the story that one tells themselves or the story that we remember, and the implicit, which is the body's story or the story that the body is telling ourselves, or the rules that we've learned from that particular explicit event. Um, The explicit is what we're aware of, the implicit is what we're less aware of, and really kind of depicts this concept, the story follows state. Um, so the implicit might be the state of the body, and then the story comes in from how to explain what I'm feeling. And it may have nothing to do with what actually is the reason for the state of the body. Um, Butterflies in the stomach, or an unease or tension, or bracing, may be coming from an incomplete survival response, but in the moment, it's perceived as external threat from some new source. And that can perpetuate all of the trauma responses, or the pain from the trauma. And a lot of this is, below the surface. Like one of the quotes that I use a lot comes from Carl Jung, when he says, "Until you bring the unconscious to the conscious, you're bound to repeat the same patterns and call them fate." And so a lot of the work that we do with trauma is kind of bringing the implicit to the surface, and so we can begin to attend to it. But so much of it is automatic. Um, And so I've got a couple of slides I want to show you that kind of depicts what I mean by automatic, and what it means. So the first image, nothing here is going to be shocking, but just pay attention to what you feel. And you might, if it's okay, just kind of put in the chat any feelings at all that you're noticing when you look at this image. And so let's see. Um, what what might you be feeling? Yeah, peaceful, right. Calm, peaceful, or some of the responses that I would get. Now notice what's different with this image, right? And perhaps a more intense. You might even have like a vocal response. So I'll just kind of move away from that. Um, but how do you explain the difference in feeling between the first image and the second, right? A lot of it is coming through from like the nervous system responses, or your the autonomic nervous system, right? The sympathetic and the parasympathetic. That so much of this is kind of bound inside, and it becomes an automatic response. It's not. You might not have said to yourself, "This is peaceful. I am now going to feel peacefulness." But that notion just automatically came to you. Um, Whereas the other image may have been more of a threat and then it created an entirely different physiological response. And this mechanism is, trauma, the pain from trauma, images and memories from trauma travels through that whole highway, um, parasympathetic and the sympathetic. Um, and so this is another way of looking at it, the autonomic ladder, where at the top of the ladder you have safety, or what they call ventral vagal, where the neuroception or the automatic internal detection of a state. Um, and so the neuroception of safety, where someone is social, engaged, and connected. But then there could be these other wordless detections, which is the neuroception of danger or threat. And so as that happens, right, that person will go up and down the ladder. And so we see more of a mobilized kind of response, fight or flight, activation, or more of a shutdown. And so this is where like the trauma-informed piece comes in, which is if you begin to look at someone from this perspective, like where are they on the ladder? It might then inform how you respond. So the first step is to know where they are on the ladder, right? Someone that's in a fight or flight mode will have a different reaction to a particular intervention than someone that's in a shutdown mode. And so if you begin to tailor your modes or your responses based upon how their nervous system is responding, that is where you might get some different results, or maybe just a slight shift. Um, I've taken this particular um, diagram from Janina Fisher, who does a lot with trauma work. She, I think, developed um, a particular a structural dissociation model, is I think what she calls it. But if you look at the individual from this perspective, that there is one side, which is the going on with everyday life work and social engagement, and sometimes folks are in that mode. But then there's this whole other mode, the traumatized part, where something is happening where their system is perceiving or kind of bringing in some of that bound energy um, that wasn't metabolized when they experienced that trauma. And they're now having that similar response, fight, flight, freeze, or shutdown. And so asking the question, who's showing up? What part of this person is showing up in this moment? And how can I best kind of interact with that person, right? How do I talk to someone in freeze as opposed to someone that's in fight mode, right? What might that look like? And just bringing in, the challenge with the holidays, right? Holiday expectations um, are intense, right? So we could have this societal, image of what we think about the holidays when people are celebrating and, families are getting together and there's laughter with dinner, and, connection. And so all of these feelings and these expectations, even having, a wonderful time at the office for holidays or the occasional awkward holiday picture. All of these things are kind of expectations. And in the meantime, what's actually happening inside for someone is that their system is on fire, right? And it's an entirely different experience. Um, and that can be an amplifier, right? If the expectation is to have a wonderful time, but their nervous system is in a state of distress or heightened threat response, right? Then they might be left feeling Like they're the wet blanket at the party. They're the person that's bringing everyone down during holiday cheer, or feeling like they're the only ones that are feeling this way, or just total isolation or despondence. And the reason why I'm bringing that in is because, the time of the year, but also this, that trauma and loss kind of share something, right? And that from the body's perspective, pain is going to be, um, the pain of loss and the pain of trauma, they get mixed. And so you're going to have similar responses and things get mixed together. They come compounding factors, and it becomes quite difficult, right? And how you might see that with a student or a coworker is going to be, isolation or distress or difficulty with regulation. Like all these different things are coming in, and this could be part of what's happening, right? Logic and reason kind of pass right through this. Um, and taking a different approach sometimes is really helpful. And so the trauma piece, right, is something that can be one of those things that is just like a connective tissue to a lot of other areas of distress. So talking about grief and loss, you might have heard this before, stages of grief and how it manifests for people, or how people kind of go through grief. And like everything that I've learned about grief or experienced, is that this is not entirely accurate, right? um, so I want to share a video with you that talks a bit about that. So let's see if it works.
Grief shows up not in the way you expect it to. It's messy. When you hear about grief, you hear about there are stages to grief and you move from stage to stage, and that's just not true at all. You might move from stage to stage, but then it's not linear. You're never recovered. People expect you to have moved to a different stage if they don't see you for a period of time. They're surprised when you're not there. I think a lot of people said, we don't know what to say. And I would always say that's cool because I don't know what to say either. But it was confusing, really confusing. And you wouldn't always know why you were not feeling right or unhappy or disconnected or distracted. You'd think it was something that was in your immediate universe, and then when you realize that it wasn't that, then the only answer was that you were grieving.
Grief comes in many different forms, and there are some common things that can be true about how we experience loss. Shock is certainly one of the things that happens early. Our system just goes into a state of shock. The loss is too big to comprehend, and we go into shock or shutdown or dissociation. I heard someone describe dissociation this way, which is it's the body's way of leaving when you can't leave. And this is certainly part of what can happen here. Right? Guilt and shame, big parts of grieving. We kind of think about like what we could have done or what could have happened differently. Like all these things come into play when it comes to, grieving. And, from a child's perspective, the guilt and the shame are profound, and it may be the case where they don't have the language yet to even describe what's happening. So now it's being felt or experienced, but with no language to even talk about it. Rage, just pure rage, certainly can be a part of it. Overwhelming sadness, and this can happen in waves without any warning. Right? Isolation. And notice that all of those aspects of grief are also aspects of trauma, right? They are following the same path. In fact, I got a really good picture that kind of describes what loss looks like. See if you can follow the path of loss. Almost impossible, right? Because that's what loss is. It's all over the place. There's no particular pattern to it. And trauma can absolutely be experienced that way as well. That, especially, with children, the idea of being able to describe it or understand it is just so difficult, especially, where the brain is developing and the ability to put words to it. And if someone is feeling this, imagine what is the likelihood they're going to reach out and say, I need some help, right? Harder to do, right? Which just creates, the cycle, keeps the cycle going. So grief is something that cannot be solved, right? It's not a problem to be fixed. Oftentimes we approach pain of others from a place of wanting to solve it or fix it. In early grief, pain is everywhere. And everyday things become landmines. Like, these are all really, these are things that happen to us as humans when we experience this loss. And the thing that's really important is that it doesn't make you weak. It doesn't mean that you're weak or you're too sensitive or there's something wrong with you. It makes you human, right? This is normal, right? This is the normal response to grieving. And so one of the things that we can do when someone's in pain is to really validate and normalize what they're experiencing is real. In fact, just today, I was working with someone that was dealing with, a particular trauma, and I offered just a validating experience or a validating response, and it was this connection. It was like, you get it. And sometimes just being able to communicate that to someone is all that we can do. And also something quite profound. So the second step, right? Once we identify where they are in the system, right? So we've got an understanding, a little bit of understanding around, what it means or what could be happening in the body with trauma, what could be happening in the body with grief, and how they could be mixing together. And the way in which to begin to identify this is kind of asking the question, where are they on the ladder? Where is this person in this moment? What do I perceive? So there's this concept of resonance where, which is like you feeling in you what somebody else is going through. So kind of picking up, like, your nervous system, picking up what the other person's system is kind of feeling. Kind of noticing what's happening in your own system. And we'll talk about that in a second. But when you begin to kind of notice that, then it's like, all right, how can I connect with this person based upon where they are right now? So I do want to talk a bit about connection. The first thing is what to avoid when someone is experiencing grief and loss. Things that are unhelpful, like comparing, fact checking or correcting, minimizing, like all these things that we do to try to make someone feel better. Offering compliments. Compliments are, really, really challenging. Like, you're so strong. Now, we might think that is something that's really helpful. But for someone that's in a state of grief, that message might be taken as, I'm not allowed to be in pain. I must show that I don't feel it. And I know that's not what we mean when we're saying that. But oftentimes that's how it's perceived. Being a cheerleader, starting with solutions. Think about it from this perspective. If you've ever come home from a particularly stressful day and you've walked in and you're just telling your partner or friend or whoever's there, you wouldn't believe the day I had. This was rough. And then they proceeded to offer you some advice on what to do when you get back in the office the next day, and how does that feel? That, typically that is not a pleasant experience, right? We are not looking for advice in that moment. And then if we get angry, then they get mad. We're like, I don't understand what the deal is. I'm just trying to help. And then it just things spiral. And think about what you might have been looking for in that moment. It might have been just unbiased, non-judgmental connection. Now, these types of approaches, even if they are instinctual, right, with a positive intention, they amplify pain. So I love this particular image. It really kind of depicts how we can show up for somebody. Person does not get more upset if they feel seen and heard. And so sometimes it's all we can do. If they're experiencing, if there's something going on, like some type of trauma response or grief and loss, if we can communicate, I see you, then we have done something profound for that other person. Also important is knowing your own system, because your kids or your coworkers, I mean, they all have nervous systems, well, so do you, and they are responding to the moment as well. So a really effective way to kind of identify what's happening in your own system is using some parts language. So if anyone's familiar with internal family systems or parts work, this is a nice way of acknowledging what you're experiencing and also creating a little bit of distance. So the phrase, a part of me. A part of me, I'm noticing a part of me is really, feeling sad and kind of anxious when I'm talking to this other person. Or a part of me is feeling really frustrated, or a part of me just noticing there is something happening in you. Another way of saying it, that something in me is ... The reason why I'm recommending using that language instead of I is that when you use I, there's no separation and it's more difficult to kind of step out or kind of have that um, perspective or that parallel process where you're kind of watching things and noticing there's some other things happening for you. So part of me, the parts language, becomes a really effective tool for using that. And I actually, um, suggest that for patients as well. But in terms of the work that you're doing, something to try or practice is just throughout the day, just notice what you're feeling and then use the language. Part of me is feeling this right now. And notice what happens, how it feels for you, how your system responds. Oop, did I just lose everyone?
We're still here.
Okay.
Yeah, we're still here.
All right. My screen sharing just stopped. I think something happened with my connection. So let me just redo that. Okay. All right. So I just want to stop and see if there's any questions or comments. Doesn't have to be, but just want to make sure. All right. So one of the things to think about in terms of how to take care of you, we tend to be our harshest critics. Like we hold ourselves to different standards, and we don't give ourselves the permission to be in distress. And so think of it this way. See, you have here an image of, a mother and a daughter in embrace, and the mother is kind of taking care of her child. And here is the message. Tend to your own distress like you would attend to your child's. Like the care, the attention, the delicacy, the way that you're um, um, approach it, the delicate touch um, of attending somebody else's nervous system. What would happen if you did that for you? Part of me is feeling this way. Oh, I get that. That makes a lot of sense. I'm allowed to feel this way. Even though I'm a clinician, I'm still a human. And so I'm giving myself permission, and then I'm going to take another step. And so this is the next step, which is this idea of internal awareness. Acknowledge, right? So we spent a lot of time right there. Kind of a part of me is feeling this way, what I'm noticing. I'm going to validate it. That makes a lot of sense. Of course you would. Why wouldn't I? Any of that kind of language. And then I'm going to ask for space. And it may seem weird to kind of go inside and ask space in yourself, but it can actually be quite effective. Is once you've acknowledged that this is happening for you, or you're feeling something in this moment, and then you're like, can I just get some space? So I'm just going to ask for some space. I'm going to go think about, and so use imagery if that's helpful, or just asking for space, or some type of indicator for you, or maybe it's something tactile. Whatever it is that kind of reminds you of having space, but totally appropriate, because when someone's in distress, when someone is experiencing traumatic pain, it's powerful and it has its own vortex and it will pull you in, and that's normal. And so it's also normal being impacted by it. Most that enter into the helping field in some way, are driven by, it's a sense of value or purpose. So it's like this stuff matters. And so it would also make sense that you would be feeling it. And instead of getting angry at that or shameful or anything else, acknowledge, validate, and think about what makes sense for you in creating space. And it might be something to kind of play around with, kind of practice a little bit, see what works, maybe some imagery or something else. For me, I just ask for space, and that seems to work pretty well for my system. But it doesn't mean that that's going to be true for everyone's system. And so you just kind of want to practice a bit and see what works. So effective communication, something to consider is when someone's in distress, we might say things like, "How can I help you?" Or "What's wrong?" Or offer some logic in terms of, everything is going to be okay. Look at the bright side, or look at all these wonderful things. We might even use reason. All of those instinctual kind of attempts of attending to somebody from their system's perspective, it's all perceived as threat. Putting someone in a state of having to answer a question or anything that is outside of validation, there's a greater likelihood that's going to be perceived as more of an attack. And then that just puts that person in more of a shutdown mode. And you might have noticed that where you've asked someone what's going on and they're unable to tell you. They're not being willful or defiant. It's probably because they're in shutdown mode, and more questions is just driving them further down into collapse. Body language. So another thing to pay attention to in terms of like how we're feeling and what we're demonstrating, we're showing. So I want to give you an example of what I mean. So you have this statement, "I'm so happy for you." Seems like a nice statement. Notice how it feels when you see this image. He is not happy for you. And what do we know, right? It's the eyes, the facial muscles, it's the posture, like everything, like the body is saying, "I am not happy for you," even though he's saying it, right? And so all of that body language is being perceived more than the words. And notice how different the words are when you see a different posture. Totally different, right? "I'm so happy for you. Oh my gosh." And so that is how powerful body language is. And so as you're noticing what's happening in your own system, notice how your posture is. Notice how your expressions are. The unintentional message that the body might be communicating. And all of that is just information. Like all of that is information for you to kind of notice and make adjustments as you are attending to someone that's in distress. Reflections are really effective. When I tell clinicians is like when you don't know what to say, reflections are great. They're really effective. They're communicating to the other person. "I see you, I hear you, and like what you have to say is really important." And so some of these concepts, and I'm sure this is nothing that is, new, but a nice reinforcement. Remove distractions. The phone, anything else that's getting in the way, take a moment and kind of create a space that is present oriented. Reflecting back what they're saying. "I want to make sure I'm getting this right. This is what I'm hearing from you." There's always an underneath. And with the underneath, it's totally okay to be wrong. Um, when you're asking someone to correct you, you're creating safety. You're giving someone agency. You're asking them to look inside themselves, to notice what's going on and to discern and then to communicate. So it actually reinforces a lot of really healthy things. Um, you know, it might impact our own system that wants to get everything right, but it's can be quite helpful if you're giving someone permission to correct the record or correct you. What am I missing? Am I getting something wrong? Or what am I getting wrong? Um, those are all really effective ways of communicating. Um, you know, on a side note, a really, interesting question to use for someone and just connecting is, what do most people get wrong about you? And it gives somebody a chance to communicate what they have feel like other people are missing, right? Gives an opportunity for that person to feel heard or seen. Um, and it might open the door for a really healthy, safe, validating connection. Other types of techniques. So these are two techniques that I'm just drawing from, therapeutic approaches that can be helpful. So they're both kind of like sandwiches, basically. So that's the reason for the picture. The first one is elicit, provide, elicit. It's from motivational interviewing. And basically what you're doing is you're engaging with someone in something where they might be struggling or providing some resistance or pushback in a different way. Elicit what do they know about the thing that you're talking about or you want to talk about. And then you provide information. So like, what do you know about this? What do you know about getting homework done on time? Or what do you know about the whole concept of homework here or something? Would it be all right if I offered you some more information about this? Then it's, what do you think about all that? So you're eliciting their response. It's an intro to a longer conversation, but it's a way of kind of getting in there that might lead to less resistance or at least kind of softens the resistance. And then the other one is the positive sandwich, positive comment, something that's genuine and affirming, whatever feedback you wanted to offer, and then following up with another genuine positive comment. So you're kind of sandwiching in between something important that you want to say. All of it it only works if the positive feedback is genuine. Folks will pick up on that. So those are two just little techniques to kind of begin conversations or start something. But I want to talk about just the concept of showing up. Right? What I call the 6 B's of showing up: being present. Begin with validation, be clear with your communication, being aware of your own feelings, things that we've talked about, being consistent with the messaging, and being open to someone else's truth. That what may be true from my perspective may be entirely different from somebody else, and their system is responding to that truth. Right? Someone that gets attacked by a dog, for example, and then they start feeling like everywhere they go, there's going to be a dog there, right? That's their system's truth right now. And if I attend to them from that place, there's connection. But if I start with, well, let's refute that, or let's look at the reason why that might not be accurate, I am trying to bring that person out of theirs into mine. And so I start where anyone is, right? I may not agree with where their perspective is, but I'm going to start there and let them know this is what I'm seeing. This is where you're coming from. This is where I'm going to be at. And then from here, we start. Any questions around communication? So let's talk about skills, a little bit of regulation. What can be helpful? So the first thing is I just want to kind of provide a conceptualization of what I mean by regulation. If I take a drop of green food coloring and I put it in a clear glass of water, right, what happens? Right? It turns green. What happens though if I take the same exact drop of food coloring and I put it into a swimming pool? Do you even notice the food coloring?
No.
Yeah. Probably not. And why is that? The volume of water, right? The volume of water is so great that it dissolves the food coloring. And so that's what I mean by regulation, is that if we can help someone expand their capacity, right, the swimming pool, then the distress that they're currently feeling or experiencing, even if it doesn't change, because their capacity is larger, it will be experienced differently. And so that's kind of the approach that I take a lot with folks, is let's work on expanding your capacity. And there's different ways to do that. And instead of thinking about how do we remove the stressors, how do we get rid of, the memories, right? You can't get rid of the memories. We can address the charge attached to the memories, but that involves capacity. And so if we help folks with building capacity in small incremental amounts, it helps them manage even the stressors. If the stressors don't change, it allows them to experience it very differently, with greater degree of relief. So here is one particular way of doing that, what I mean by bringing in stabilizing energy. If you think about, for example, where anxiety lives mostly, it often, people talk about it, they feel it in their chest, it's in their neck, it's in the jaw, it's in their shoulders. It's a lot of the times it's localized in the upper body. So what can be helpful in that moment is when someone's in a lot of distress, is I bring their attention to the lower half, starting with the feet. Pay attention to your feet. Notice, how the feet are connected to the floor. If they're sitting on a chair, can you notice what it feels like with your legs kind of connecting with the chair? Essentially what I'm doing here is I'm bringing attention to, what they're feeling, and then I'm trying to help them find somewhere else in the body where they're feeling differently. And essentially, so I'm going to stop sharing for just a minute to kind of show you. If this is anxiety, distress, right? And so someone comes in and says, this is my world. This is what's happening right now. I don't know. I can't see anything else. And we're like, yes, of course. That's exactly what's happening. And I'd like to bring your attention to something else that's also happening, which is different. And that's the stabilizing, right? That's the feet, the legs, or the orienting. I'll get that to that in a second. So basically, that's how you expand the capacity. When they're in distress, the world is like this, and all they see is pain. And so what I help them do in that moment is I don't invalidate the pain, but I bring into their awareness, there may be more here than just pain. And can you notice that for a moment? And that expands their capacity. Right. Okay. So another thing that's really helpful is just mindful awareness, um, tuning in and turning towards, right? Avoidance tends to amplify the distress. Resistance to stress amplifies stress, or pain plus resistance equals suffering. Like these are, we're naturally kind of organized around resisting pain. We don't want it. And so we kind of reflexively do that. And what may feel like opposite role to a lot of folks is asking them to notice what they're actually feeling. So the thing that I would introduce into this though is titration. So think of it in terms of outer edges to the center. So the periphery to the center. A small amount of the distress, the outer edges of it, notice, turn towards, instead of diving into the center, and start at the edges. Dan Siegel, a neuroscientist, coined the phrase "name it to tame it." So another way of just kind of helping someone experience some relief is naming what they're feeling. Oh, this is anger you're experiencing. And noticing that. And take a moment to bring into your awareness something else that isn't angry. Maybe paying attention to your feet, noticing what your feet feel like. All right. So we're naming it, and then we're bringing in some capacity. And so when you detect and you describe, you can distinguish between what's true and what's not true. Right? What's here or what isn't here, right? Or then versus now. Right? So a lot of times with trauma, right, it brings the person back to where the event happened, and then their system is acting as if it's back then. And so naming it allows a person to notice, oh, this is actually a feeling from that time. That's then. Now, this is how I'm feeling. Right. So I am creating space in their system. Same thing with orienting. Right. Orienting just is really powerful. It allows the person to notice what's going on in the present moment. So it brings them back to the present, whereas all that traumatic pain is going to take them to the past. Your system's going to operate that way. And orienting, looking around your room, notice everything you see. You might be familiar with like the 5 things. Like that's orienting. And so using orienting is a way to help build capacity then versus now. And so just, some ideas in terms of where someone's nervous system is at and some of the techniques that can be helpful in those moments. Someone that's engaged, that noticing and awareness becomes really effective, and that then versus now can be helpful, validating, problem solving. Like when they're in that social engagement, then they're in a space where they can begin to problem solve, right? Whereas in sympathetic mode, distraction, movement, breathing, posture, all these different things can be very helpful. Notice your spine. Right? Posture is also really helpful for parasympathetic. Movement, you're seeing that a lot. I actually put movement twice in parasympathetic. It's important, like helping your system get out of freeze into something a little more active. Well, I actually put movement 3 times. I'm just reading that now. It's important, I guess. And the other thing is, well, I love this slide, so I wanted to just put it in because it's so fun. But permission to play. Um, Playfulness is such a restorative, um, you know, process. Um, you know, it allows us to practice and play and experience and validate and feel safe and recognized and heard, like all these wonderful things. Anytime that you can introduce something playful, um, you know, when it's appropriate, like when they're in that engaged place, maybe playfulness becomes a really important way of helping to support their system even further. Um, so I wanted to end on this video. I think all therapists are like required to watch Inside Out. This is actually from Inside Out 2. Um, and this is a great depiction of what I mean by like internal um, validation, like supporting your own system. That in this, you get to see how um, instead of fragmenting or judging or pushing away different aspects of yourself, how what it looks like to just embrace all aspects. Um, so let's play. Riley is actually having a panic attack right now. That's the young girl.
I'm a good person. Joy, what are you doing? I'm selfish. I'm kind. I'm not good enough. I'm a good person. I need to fit in. But I want to be myself. I'm brave, but I get scared. Success is I make mistakes. I'm nice. I'm mean. I'm a good friend. I'm a terrible friend. I am strong. I need help sometimes.
And the exhale. So, baby steps. As cliche as it sounds, it's really effective. Small movements lead to big changes. So anything you do, titration, small amounts, layer by layer, really is very supportive for anyone's system. Give yourself permission to explore, experiment, experience, struggle, totally fine, right? It's just about being human. Um, and know that you already have everything you need. Um, just like the folks that you're serving and taking care of, like it's all there. It's already inside. And we just kind of help facilitate access. And that's what I had for you today.
Thank you, Patrick. I really enjoyed that. Does anyone have any questions for Patrick or anything they'd like to ask, clarify specific situations perhaps that you want to know more about or anything at all? Okay, well, I appreciate you all being here tonight. I hope you found that useful. I definitely found a lot of good things in it that will help me working with young people, especially even my own kids, I think. So,
Hmm.
and
Yeah.
myself. So,
Absolutely. I appreciate it. Thank you very much. It was very informative.
Gave us a
Thank
lot to think
thank you,
about.
Kelly. Yeah.
great.
As always, stuff assimilates and sometimes it kind of lands differently later on. I am available to support you. Horizon is available to support you. And so, if anything comes up, feel free to reach out at any time. We're here to help in any way that we can.
Thank you, Patrick. And we will send out information via email, and whatever email you registered with, we'll send further information, a copy of the recording of tonight's seminar, the handouts that we have here in person, things like that. So be looking for an email from us.
Thank you.
Yes,
Thank
Yeah,
you.
contact. Oh, you're welcome. My email. Um, yeah, let's see.
it was on the last screen, but I don't.
There we go. So that's my email. Um, I can share with you my phone number as well if you'd like. And that's 462-0914. And that's my direct line. So you can email or you can call me or text or email. And then the resources that we have the general contact number for Horizon if you needed to kind of link for services.
Thank you. All right, thanks everybody. Have a happy Thanksgiving.
Yes.
Rest. Try not to get snowed in. But enjoy the holiday as much as you can. Thank you.
Thanks, everybody.
Thank you.